Hi, I'm Dr. Jacob Teitelbaum, and today we're going to give you tips for having a healthy pregnancy. Now, your doctor will talk about some of the basic things you need, like iron and calcium and things like that, but we're going to talk about those critical tips that your doctor just hasn't been taught about, and that's usually because they're not expensive. Now, it's important to understand that when they make prenatal vitamins and the FDA approves them and such, it costs a lot of money to go back and reformulate and republicize and get reapproval. So most of the time, the drug companies have really not changed the prenatal vitamin mix to keep up with research for sometimes 10 to 20 years. And they're very, very out of date. So we're going to give you some basic tips on you can have a great pregnancy and a healthy baby. Now, the critical, most important tip that you need to know is that you need to optimize thyroid hormone function. This is the case even if your blood tests look totally normal for thyroid. Let me give you an important point. There's a blood test called an anti-TPO antibody. Anti-TPO antibody, write that down, which looks for a disease called Hashimoto's thyroiditis. About 13% of women will have that during pregnancy. And if you have that blood test positive, your risk of having a miscarriage increases 400 to 500%. And your blood test for thyroid will still be normal in most cases. The research shows that by simply giving a little bit of thyroid hormone, even though it's prescription, one, you're going to feel better, but it decreased the miscarriage rate down from about 14% to 2.7%, totally down to normal. Now, thyroid only costs about 10-15 cents a day. It's very cheap. But that's why nobody's spending the money to teach your doctors about this research. And this is not just one study, but many studies showing that you need thyroid hormone. If you're tired, if you're already taking thyroid before the pregnancy, you have to increase the dose by 30% during the pregnancy. Also, if you have low thyroid, even with normal tests, your child has a risk of learning disabilities and learning and other behavioral disorders. So again, if you have fatigue, you should automatically be on thyroid during your pregnancy. And if you have a TPO antibody positive, twist your doctor's arm, get them to give it to you. Another critical thing in pregnancy is to be sure you get your fish oil. Research has shown that by giving fish oil, you decrease the risk of postpartum depression markedly. Now, this happens because most of your brain is made up of DHA, docosahexaenoic acid, which is a special oil that comes from fish oil. And because the American diet is getting more and more deficient in it, when you get pregnant, your baby's going to take all the DHA it needs from your diet to make its brain. And if there's not enough in the diet, it's going to take it out of your brain. And once you deliver the baby and your hormonal support drops postpartum, people will get thrown into postpartum depression. So whether you have postpartum depression or are simply pregnant, be sure to get your fish oil. Because of the mercury issue, probably better off getting the fish oil, but get one that's mercury free. I like Eskimo 3, that's my favorite, or Nordic Naturals would be another good one. Both of those are mercury free and safe to use during pregnancy. I would take 1 teaspoon a day. Also, you want to avoid hot tubbing during pregnancy. Fevers and having a high temperature can cause birth defects in the baby. So you want to take a hot bath instead of doing a hot tub, because the bath will usually be at about 100 degrees, most of your body's out of the water, half of it, and the water cools down, where the hot tub is staying at 102 to 104 degrees. No hot tubbing during pregnancy. Now again, if you did it once in a while, don't worry about it, but just in the future, don't. Also, vitamin A, do not take more than 8,000 units of vitamin A a day. I'll limit it to 4,000 because it will cause birth defects. Beta carotene is okay, but no more than 8,000 units of vitamin A. So these are just a couple simple things you can do to really have a great pregnancy and a healthy baby. Now, for more information, I invite you to look at the 10 Tips for a Healthy Pregnancy article on my website at vitality101.com. Also, if you know anybody with infertility, our website has an article on natural treatments for infertility that are very effective. And we're also now doing a study in our research center, which can be done easily by mail, that we think will help people with infertility to get pregnant. So this is Dr. Jacob Teitelbaum wishing you a happy pregnancy and a happy baby.